Hello, 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 everyone. So we're just giving folks a moment to join. Thank you for joining us today. We're super, super excited to bring the PrEP Navigator peer-to-peer group. Oh my God. We still have some people trickling in the room, so we're going to give them about another minute or two, and then we'll get started. Thank you for joining us today. We are so excited to have you.
We'll slow down a little bit if we want to get started.
Yeah, and then also if we can get everyone to put their region and their organization in the chat so we can know who we have in the house today. And we're gonna go ahead and get started. All right, welcome and introduction. So again, if you can put your organization and your region in the chat so we can know who we have in the house with us tonight or today, that would be greatly appreciated. All right, so I wanted to introduce the PrEP Navigation peer-to-peer group team. I'll start with myself. So my name is Roderick Shepard. My pronouns are he, him, his. I'm a manager on the prevention team, and I'm leading this effort alongside with Nicole and Cody, and I'll allow them to introduce themselves a little bit more now.
Hi, everyone. My name is Nicole Elenoff, she, her pronouns, and I am with the prevention team here at NASTAD, and very happy to be part of this effort to get this space developed. We definitely know that there's a need for a peer-to-peer group for PrEP navigators, so very happy to be here, and I'm going to pass it to Cody.
Awesome. Thanks, Nicole and Roderick, and good afternoon, everyone. Excuse me. My name is Cody Schaefer-Fritz. I use he, him pronouns, and I'm a consultant, and I work on a variety of different projects with NASTAD's PrEP, TelePrEP, and PrEP Access teams. So very excited to be here and to be able to support you all in this work.
Thank you, Nicole and Cody. And just to give, I guess, a little background about me and my prior to working here at NASTAD, I was a PrEP specialist. I was responsible for following up patients for the 3-month follow-ups, and we would actually do their 3-month follow-up appointment. And we worked alongside with the PrEP Navigator. We had a very close-knit relationship with our PrEP Navigator in the PrEP clinic. And so it's something that I've become very passionate about because the experience was a really, really good experience. It was a job that made me feel like I could do my job. It was a very efficient program. They had retention efforts and everything. Like, it just was quite the experience that I'm hoping to share with you all as we get to know each other a little bit better throughout this program. All right, so to go into the agenda, today we're going to review the purpose and the goal of the PrEP Navigator peer-to-peer group. Then we'll have a PrEP Carson presentation by Amy. And then finally, we'll have time for a Q&A and a facilitated discussion. And then before everyone leave, we do have a Mentimeter survey that we would like you all to complete just to get some feedback on your experience of the first session. And then finally, we'll also discuss about the next meeting in July. All right, so the purpose and the goal of the PrEP Navigator peer-to-peer group is a space for EEG Phase 1 jurisdiction members and PrEP navigators to meet and discuss topics impacting PrEP access, share resources, and learn from each other. This is definitely a space that we hope you'll be able to network and navigate a space with your peers. There's a lot that I do believe we can learn from each other. So is there anything else that you wanted to add to this, maybe Nicole or Cody? Okay.
No, I think you said it all really well.
All right, perfect. So I'm going to stop sharing my screen to allow Amy to go through her slides. All right.
Terrific. Hi, everybody. So super excited to be here. So I'm just gonna I'm gonna share my screen. Give me 1 second. I'm bad at multitasking. And 1 second. Let's make sure I do this right. There we go. All right. Cool. Can everybody see my screen? Yay, see thumbs up. That's what I like to see. Okay, so basically what I'm going to do in pretty short order is to walk through the sort of landscape, and just to sort of spoiler alert, this is a changing space, but the landscape for PrEP coverage and cost sharing requirements, where we're seeing some challenges, what to do about those challenges, and then sort of end with an update on the state of play as to some of the overarching policy and legal litigation, in particular, challenges that we're monitoring. And then we'll leave plenty of time for questions and discussion. So let's start with just kind of the lay of the land, and even just zoom out to PrEP and insurance coverage. You know, so this is actually from the data is from 2018, but this was a report that was published just a few weeks ago. And if you haven't had a chance to take a look at it, I urge you to. It's an interesting read. It's from a bunch of folks at CDC who parsed a number of different data sets, and you know, the report does a whole lot, but in part breaks down in a really nuanced way where people with PrEP indications in the US are getting coverage. And so, you know, I think what's interesting here is that you do see some breakdown too across different groups. So we're going to be, for our purposes today, really focused on that first group of privately insured folks. And so you see, if we take the total of people with a PrEP indication, that is where the vast majority of folks are getting coverage. So it makes sense to sort of have an outsized focus on this payer source and how well and it is or isn't doing for PrEP. And just to note, like, this is not monolithic. So, you know, you see it when we start to break down the different categories and communities who could benefit from PrEP. It does look a little bit different, and just kind of like editorial, we should be spending more time on Medicaid coverage, particularly for women who are not getting PrEP. That skews toward women. And so that is probably a conversation for another PrEP discussion. But for today's purpose, we're going to focus on that first bucket of folks who are privately insured. And so, you know, to then kind of next step is when we talk about PrEP and when we're trying to really like parse out what does coverage in a private insurance system, what does that look like for PrEP? You sort of have to step back and think, what do we mean when we talk about PrEP? And this is important because you all, everybody on this call is steeped in this. So everybody on this call sort of intuitively understands PrEP is far more than a pill. But I think like that has been a really difficult message to get through to folks who are not steeped in the PrEP world, that you actually have a set of services that go together that are part of the PrEP intervention, that covering the pill is not enough to cover all of the pieces that are necessary for PrEP. So this is actually a table from a paper that several folks from NASDAD and others at UVA put together a year or so ago now. And just kind of walks through both the services and then gets at an estimated cost. I only mention this because I just think it's just important to kind of know what we're dealing with when we're talking about what insurance covers and then what it doesn't cover and what that means in terms of patient and or provider costs. And so, you know, this paper sort of took into account pre-CDC updated guidelines and long-acting injectable PrEP. So when we add Apretude, which is the one long-acting injectable PrEP product approved on the market right now, you know, averaging out a monthly cost for that, you get about $1,800 a month. And then when we add in the HIV RNA test, which is now part of the CDC guidelines for PrEP, for long-acting injectables in particular, that is not an inexpensive test. So this kind of just gives you a sense of when we sort of put all of it together, it is not an insignificant cost amount, really kind of making the case of we have to really push at all the places we can to get as many of these pieces covered, ideally without cost sharing from private insurance. And so, you know, that leads us to, okay, what are the requirements in place for private insurance to both cover PrEP and then, you know, to insulate consumers from any cost for PrEP. So by that, I mean to have no cost sharing so that when you go in for PrEP, you're not paying anything. And so there we start with the US Preventative Services Task Force. So there are two things to kind of know about this and that are important. One is that you have a longstanding body, the USPSTF, the US Preventative Services Task Force, which is sort of a quasi-independent body made up of a mix of clinical experts, right? And they review like just reams and reams of evidence, and they make assessments about different preventative services, right? And so they look at the evidence and they say, yes, this solid evidence, limited risk, and we're going to give it, and there's like a grade system. So that body's been in place for a while. It was always sort of an important clinical reference tool to know, you know, which services had the you know, biggest effectiveness profile. And then the ACA kind of like amped up the importance of this formerly just kind of like wonky, but not well publicized body. And the ACA said, okay, we're going to take the recommendations of this body, and any service that has an A or B, so those are the highest recommendations you can get. Any service that has an A or B rating, the ACA says, private insurance plans, you have to cover that service and you have to make it free to the consumer. So basically saying, you know, these are the services that have the best effectiveness, they're going to do the most for public health, they have the least risk to them. And so we're going to require insurance plans to cover them, and we're going to require insurance plans to eat the cost. So not to allow any cost sharing for the services. And this applies to a great many plans. So the reason why private insurance is so important for PrEP is not necessarily that there's something magical about people with a PrEP indication in private insurance. It's just like the fact that private insurance is where most people in this country get their coverage. Employer-sponsored insurance is like the place where the vast majority of people in this country have coverage. And this mandate applies to virtually all of that coverage. There's a small slice of what are called grandfathered plans that have just been in existence for a long time. That it's a small slice and it's an actually shrinking slice. So we're talking about the vast majority of private insurance products to whom this requirement applies. And then what you saw, to the point about being specific about what we mean by PrEP and what interventions fall under, or what services fall under the intervention. Federal agencies clarified a couple of years ago that in response to plans saying, yeah, we'll give you the medication without cost sharing, but then charging cost sharing for labs and clinic visits. The federal agencies came out and said, no, PrEP is way more than a medication, and you plans, in order to be compliant with this requirement, you have to cover all of the services without cost sharing, not just the medication. And that means all the labs, that means the clinic visits, and that means counseling services, because those are the services that make up the intervention. So that's huge. And that was a really big, a big win for PrEP providers and advocates and people who are on or need PrEP. And when it came to medication, that's another piece that's very dynamic in the PrEP space. As you all know, we've got new medications coming on the market. And the federal guidance also clarified that, sort of recognized we have more than one medication for PrEP, and said basically plans can preference one medication over the other. That's within the plan's right under medical management techniques, but they have to follow clinical criteria. And the example here is, plans can certainly preference generic TDF-FTC. I think many would argue that they should. That's the right thing to do, over Descovy. But there has to be a pathway to get Descovy for the very small number of people who have a clinical indication for Descovy. And then finally, because I mentioned long-acting injectable, we have one product on the market, but there's a pipeline making its way for other long-acting products. The USPSTF is actually currently finalizing an update that would include specifically Apretude and that long-acting product, and will likely include that. The draft recommendation will likely not change that much as it becomes final. So that's the kind of state of play when we think about the federal coverage requirements for PrEP, and it's all pretty good news. And then we kind of get to the bad news, right? That you can have the best law on the books, right? And this is not unique to PrEP, but often you just have a disconnect or daylight between what the law says and then what implementation and compliance looks like on the ground. And so even though we have the ACA and we have this very specific requirement that plans cover USPSTF grade A and B services, and then on top of that, we have federal agencies saying, let's be very clear about what we mean when we say you have to cover PrEP and all of these services without cost sharing. Despite all of that, we still have basically chaos in a lot of areas when it comes to plans actually covering these services without cost sharing. So I just pulled but a few, plucked from the headline stories about the problems that persist in PrEP coverage and cost sharing requirement compliance. And this is not limited to a certain state. This is not limited to a certain community or subset. It's not limited to a certain plan. We're seeing just sort of across the board that despite all of these requirements, folks are still getting charged cost sharing. And sometimes that's ending up in people stop taking PrEP. Sometimes that ends up in providers, you all working out there who are seeing cost sharing come in and are using grant funds and other funds to pay that cost share to insulate the client. That's not great, because that's not supposed to be a cost that you all are paying. And so we see this continue. And, I think that there's what we see in that space is the primary challenge, and I don't want to say, I think the challenge is sort of across all of the different services, but a main challenge that we see are cost sharing being charged for the labs or the clinic visit for PrEP. So the medication, we certainly see issues with prior authorization, and I suspect we'll see more issues with Apretude and Descovy than we do with generic TDF-FTC. But putting the sort of pharmacy benefit aside, what we see in terms of the issues are, despite the mandates that the labs are not recognized as this ACA preventative service and being looked at as non-preventative, right? So potentially diagnostic. And so the patient is getting a bill. And so then you can imagine there's like several fold issues. Number one is that for the most part, if you get a copay, you're going to do one of two things for most people. And I'll talk about the subset of people who aren't doing this, but for most people, if you get a copay, you either just pay it, or you might say, well, this is too expensive, I'm not accessing the service anymore. And those are like the two primary routes of what consumers do. And I say that like, that's probably what I would do. And there's been reams of studies of like, the pain has to be high enough for you to like appeal it. Or you have to be a particularly savvy consumer and know that, hey, I know that I'm not supposed to be charged a copay for this lab, and I don't care that it's $25. I'm going to appeal it. And so I just want I want to talk through what it looks like to appeal a charge, but just like really underscore the point that like this is the fraction of people who are appealing are but like the tip of the iceberg of a larger problem, whereas most people are either paying it, or the provider is figuring out some way to grant fund it, or they're just simply not picking up their PrEP anymore and discontinuing it. For the people who, again, are either working with a PrEP coordinator or another entity that knows, the law and knows that this is not, they should not be getting cost sharing, or who themselves are in the PrEP space and know they shouldn't be getting cost sharing, there are certainly processes in place to appeal that. And I have a link here, and I think we'll chat out NASDAD's complaint template that sort of walks through the different components here. And part of it is like the entire US healthcare system, it is just fraught with complexity. So the path that, if we start with the consumer on the left there, the path that person has to go through to appeal their cost sharing, right, varies depending on what type of product they're in, because we regulate insurance plans instead of like all together, we regulate them in different segments. So qualified health plans, someone who bought a plan through the marketplace or in the individual market in their state, that plan is going to be regulated by a different set of like a state regulator, as opposed to a self-insured. So if you've got clients who are employed by Walmart or one of those big corporations, they're usually self-insured. Those plans are not regulated by the state. They're regulated directly by the Department of Labor. So I'm not going to go through the nuances of that system. The template does parse out what plan is regulated by what entity, but that's often like step one. What does your plan look like? A, is it ACA compliant? And then B, which plan type does it fall under? And then we move to, okay, like I figured out what plan I have. What do I do with that? And so where should you file a complaint? And it's usually, you sort of tier it up. Like you start with, go to the plan, or if you're in a self-insured, large employer plan, you go to a benefits administrator. You go, usually if you're in an employer plan, your employer's human resources department oversees the benefits. And so you have to go there. I get that causes some confidentiality issues for many people. A state department of insurance regulates a slice of plans, the Department of Labor regulates a slice of plans, and then the Federal Centers for Medicare and Medicaid Services regulates a slice of plans. This is a fraught system. So, there are people there to help. NASDAD can certainly help at least navigate, not necessarily do complaints for people, but navigate how to start and where to go. But this is not an easy system. But nonetheless, if you have clients who are coming with lab or clinic cost share, or you see that because you're working in a clinic setting and you know that, EOBs are being generated that have cost shares attached where they shouldn't, it makes sense to be filing complaints and to develop paper trails for all of that. And that's often how regulators eventually act, is by having enough complaints to point to say, oh, this is a problem that's bigger than one person. And I looked everywhere. I was like, is there any graphic that would like make billing and coding look interesting and fun? And this was the best that I can come up with. I think it's interesting and fun. But a subset of this is that it's, and where I tried to like focus us here is that how we like transform your clinic visit to what ends up getting paid. It's like a translation, right? So you go, or your client goes to their PrEP provider, and the provider is going to collect insurance information, right? The provider is going to do the service, and that service is going to be documented in a record, right? It's usually like a medical record, an electronic health record. And so like whatever was done is in a record. If labs were ordered, it's in a record, right? And then on the back end, like that you and I never see because it's not part of any sort of consumer facing, on the back end, you have a whole system that is charged with translating what happened in that clinic visit and encounter into a language that an insurance company will recognize and then pay, right? And so the only thing I want to say here is that like that back end piece where like we're trying to translate what's happening in that PrEP encounter in order for an insurance company to be like, oh yeah, PrEP, ACA preventative services without cost sharing, check. There is no good way to translate, right? Like it's like we have different languages. There's just not a good way for anyone working in that sort of medical billing space where that orangey block is to translate what is happening with PrEP into a language that an insurance plan can immediately know and recognize and say, oh yeah, PrEP, no cost sharing. And that's a big problem. And that's a sort of policy problem that is a coding and billing problem that NASDAD is trying to address in another related project, updating the billing and coding guidance that the organization put out back in 2016. But I can't talk about PrEP and what's happening in private insurance coverage without talking about that orange block, because it is sort of a mess right now that we really don't have great ways of translating what's happening in a PrEP visit to make it so that an insurance plan understands and knows that whole visit, the labs, the medical visit, combined with the medication has to be covered without cost sharing. So what I want to end with, and then we'll move into the Q&A and discussion, is that many of you, likely are closely following the news and saw the news at the end of last month that a federal district judge in Texas ruled in a well-publicized case challenging the ACA's preventative services requirements and issued what's called a nationwide injunction, which basically immediately struck down the ACA's requirements for plans to cover USPSTF grade A and B services. So in any of the services that were issued before, or I'm sorry, that should be after 2010 without cost sharing. So the takeaway here, right, for us, this is bigger than PrEP, but includes PrEP. PrEP was issued far after 2010. The case and the decision is far reaching. So a nationwide injunction is a big deal. It basically says, this Texas judge is, finding that every single plan, the requirement, the mandate can no longer apply. So what that means is that it doesn't mean that the mandate itself, like the plan design of having $0 cost share for PrEP or other preventative services, is illegal. That's not what it means. It means that regulators can't enforce it. And that's an important distinction that I'm going to get to in a second. But despite this like really big and scary and far-reaching decision, there are a couple things to watch. One, the federal government immediately appealed. So the how our court system works is that you've got appeals. So it's going to go up to a Fifth Circuit Court of Appeal, and then it's going to go to the Supreme Court. And the federal government also asked for a stay of the decision during the appeal. And that basically asked a court before ruling on the merits of the appeal just to say, listen, this is a big deal. Let's just keep the status quo. Let's just keep the requirement in place during appeal so as not to, mess with the current system and market and the current requirement. And we haven't heard a decision on whether the stay is going to be granted yet. So we have to see what happens there. And I think what I would say to you all, since you're working day to day with folks who are accessing PrEP, we're going to see some plans that are going to say, hey, I don't have to do this, so I'm not going to. But for the most part, this plan design is incredibly popular. People like preventative services without cost sharing. People like that benefit. And it's also popular on a plan level. It's often a really cost-effective way to provide care. You want people to get preventative health. That forestalls something far more expensive. Plans actually like that. So there's reason to believe that even though the mandate is kind of on hold right now, that most plans and employers are not going to immediately jump ship and say, oh, all right, we're not doing this anymore. You'll see some changes, but not a massive amount, especially while the case makes its way up to the Supreme Court. So it's something to watch, and I'm happy to take questions about that if you guys are hearing from folks or you have questions about how it operates. But what I've been trying to impart is that people should still be accessing their PrEP. For the most part, it's still going to be covered without cost sharing. Many states have embedded the federal ACA preventative services requirements into their own state laws, which are not at issue in the Texas case. So, you know, there's reason to believe that, at least for right now, the status quo and this protection is going to hold in most places. But it is something that we all need to follow, and we all need to kind of be prepared for the final outcome, which we don't know. The Fifth Circuit and the Supreme Court, it's hard to say what they will do with this. So that's kind of the latest in terms of the legal challenges. So I'm actually gonna pause. I'm gonna stop share so I can see your faces, and then we can stop and open it up for questions.
Feel free to place your question in the chat, or if you want to come off mute and have a discussion and ask a question, then feel free to do so.
Any questions for Amy? I have a question for y'all. So in this space, like, this is a session for navigators. And this topic came up, quite a bit when NASDAD sent out just an assessment for like what PrEP navigators would want to talk about. And I'm wondering, like, how are some of the navigators in this room, like this virtual space, currently navigating some of the challenges that Amy spoke to in her presentation? I'm sure some of you have experienced your patients receiving a bill when they shouldn't have. So how have you all been working through that?
Hello, Nicole. Can you hear me?
Yes, we can hear you.
Okay, awesome. I am like off-site, so please excuse any noise that you hear in the background. But my question for Amy is with respect to at least the way, and to answer your question as well, Nicole, the way that I have been navigating as PrEP navigator for folks who want to get on, who need help to pay for PrEP is first, my primary is making sure they either have Medi-Cal, or if not, getting the Medi-Cal. That seems to clear up a lot of the issues. But for the folks who don't qualify for Medi-Cal, or who would prefer not to use their Medi-Cal because of privacy concerns, sometimes I have encountered issues with getting them onto payment assistance programs with some of the manufacturers of PrEP. And like, for example, some of them need to have proof that the person was denied benefits for Medi-Cal for them so that they could qualify, for example, for Gilead's payment assistance program. And it's not that they don't have Medi-Cal, or maybe they prefer to not apply altogether because of other privacy concerns beyond, family knowing, for example, if this person is of unknown migrant status. So that has been one of my issues, kind of getting around that. And please, if it was already answered during Amy's your presentation, I apologize, but could you give a recap as to what the options are for those folks who would rather not go through public coverage and would prefer to stay as private as possible?
Yeah, so it's such a good question, Mario, and thank you for raising it because this has come up and not even just for PrEP. I mean, I think for any number of different more sensitive services. One thing I would say that I think it's important to sort of start with is to sort of have an open and honest conversation about what the privacy concern is. So, for instance, Medicaid programs in most states, and I would have to look up the specifics of Medi-Cal. There are protections where there's not the EOB generated. There's no EOB generated. There's not a paper trail that's going to be sent to someone's home in the same way that you have some variation with that in the private insurance space. Or you can request that EOBs not be generated or sent. And we can certainly send out the folks in the reproductive health space have actually been just incredibly on top of this topic and have put out a lot of different materials that are very relevant for PrEP as well, in terms of noting, where the state requirements and protections are that actually require suppression of EOBs so that you're not generating a paper trail for sensitive services, and or allow people and via their providers or via themselves to request EOBs not be generated. So that's number one. And for Medicaid, I believe EOBs are not generated if there's not unless the service is denied. So that's number one of like really understanding, okay, like I hear what your privacy issue is, but like walking through, like, is there a way to talk through it that makes that you can sort of find a path to coverage? Because that's the goal, right? If you're eligible for Medi-Cal or any other public payer, you want somebody in that, because it's not just for PrEP. I mean, Medi-Cal is a big deal. That is a generous program. You're going to get lots of other services, not just PrEP services. So that's like number one. And I like to start there because I think like the goal should be to get the person the most comprehensive coverage they can. And then, certainly you just have people who for whatever reason, and the example of being in a mixed status household is a really good one. Sometimes people just don't want to risk it to flag any other family member who may not be in this country legally. California is a little bit of a different animal in that regard, just because they actually do open up public programs, including Medi-Cal, to many undocumented folks. But that sort of aside, I think the other option there outside of patient assistance programs, where there is usually a requirement that you not have access to public or private insurance or denial of insurance coverage, then you kind of have to look at like, are there other safety net programs? And 340B is in programs that are operating under 340B or state PrEP assistance programs just can often be like a safety net to the safety net to sort of cover and capture folks who are, again, it should be a very small amount of people. And you're talking about people who are actually eligible for other programs, but for a specific reason don't want to or can't enroll. But I just want to that number should be very, very small. So hopefully that helps. There's not a great number of options because a lot of our systems do require you to go to a public program if you're eligible for it. But there are some kind of safety nets underneath that.
Thank you, Amy. That does help to clarify it.
I just put a couple things in the chat. So one of them is a link called My Health, My Info, and that's a California specific link, but individuals can go to that and help with the confidential communications request. And then I also put a PDF in the chat, and this came from our partners over at Washington University, where they put together a resource on PrEP and explanations of benefits. So wanted to share that as well.
Awesome. Thanks, Nicole.
I had a question. I am working as a PrEP navigator at a community health clinic in the Carolinas. And because we offer help to a lot of people with a sliding fee scale and also free services, we usually get a lot of young people coming in, a lot of young people and college students who may still be on their family plans. Is there any resource that you can reference that I could be using for people who maybe are trying to keep things confidential? I have had several instances where people who are still on their parents' plan are scared of starting PrEP because they don't want information being sent to their parents that would be indicating that they are using PrEP services for any number of reasons. I was looking at the cost sharing template that was shared in the chat, and I feel like even with this resource, it might be more difficult for someone who may not be the person on the insurance plan themselves that is trying to dispute a cost.
Yeah, you're pointing to just like an incredibly important and just hard to solve issue. So I'm going to put in the chat resources from the National Family Planning folks, or NIFRA. Because as I said, like the reproductive health community has just done a lot in this area. So that link that I put there includes all of their work on confidentiality. And so they do a few profiles and different different policy solves. So there is in many plans, like just allow this, and many states require it, to ask the plan not to generate a paper trail, right? So like the plan doesn't necessarily have to send the subscriber the information. Now, the problem is, like, even if an EOB isn't like printed out and sent to a person's home, you know, your parents' home, for instance, if the main subscriber, and anybody who's on a family plan knows, like if you're the main subscriber, you often just have access to the portal. So like I don't want to like make light of, like, there are some fixes to this, and there are some ways that you can request information to be kept confidential. But it is sort of problematic, and you are taking a little bit of a chance, because your primary, like, your parent is the payer, they're the subscriber. They can ask the plan for information. So that's number one. But as a start, it should be a call to the insurance plan to say, you know, can you not generate EOBs for these services? And that is something that sometimes they will say, okay, we won't do that. And other than that, it's sort of like the same exact question that we just went over with Mario too, of if you have access to private insurance but you don't want to use it, where are your options? Again, you know, the patient assistance program route is going to be limited because of the requirement that you know, you have exhausted public and private payer resources. You know, same with Ready Set PrEP. You have some state PrEP programs, PrEP assistance programs, and you know, some programs that are just sort of, they're public health, they're not going to ask about insurance, but most are. So those are limited. So going the route of like trying to ask the plan, and then the other route, you know, if you're in college, that's not really going to work. But no, I'm not going to go down that road. So those are some considerations.
Okay, thank you.
Mm-hmm.
Hey, Amy, I'm Scott with the Kentucky Department of Public Health. Have you had issues with people on Aptitude having to pay a copay or a large amount of a copay?
I have heard those issues, yeah. That, you know, so the Aptitude kind of presents a lot of different problems. Number one, it's not specifically part of the USPSTF recommendation right now. So, you know, plans by the letter of that recommendation can, and sometimes some plans are recognizing it and acknowledging it as preventative service and you know, providing it without cost sharing, but some are not. They will allow, you know, TDF, FTC, and on some limited circumstances, Discovery. But if you take Aptitude, you know, you will be subject to copay, and in some cases co-insurance. And if you're in your deductible, like, that's a lot of money. So that's for sure happening. And there's not a ton of recourse until the USPSTF changes their recommendation. And then even after that it takes a year for that to go into effect, assuming the, you know, the ACA preventative services still hold. So we don't have a lot of like regulatory pull on that right now. other than to kind of try to push plans to recognize Apertude as part of the suite of PrEP services that are really important and should be recognized without cost sharing. But that's more of it's the right thing to do rather than it's legally required by law to do. With Apertude, we're also seeing that, the cost, folks are also getting cost sharing with the labs associated with Apertude as well, which can be expensive specifically because of the RNA test. So that is like not a great synopsis of Apertude, but that's sort of where we are. But I will, maybe the hopeful part is that I do think that because of the clinical benefit and because USPSTF is currently looking at it, a lot of plans are recognizing it, or at least like some plans are recognizing it as part of the USPSTF services that have to be covered without cost sharing. So I'm not surprised that you were getting that. It makes sense to maybe try to appeal it, but there's less legal ground to stand on with it.
Well, coincidentally, I just got a text from someone asking me they were charged $180 through United Healthcare for their Apertude. So,
okay.
And I said, well, I'm on a call actually, so I'll ask. But
yeah.
Thank you.
Challenge it. I mean, that's the thing, like always challenge it.
I'll tell them.
Yeah. And you never know what's going to happen. And then, thank you for Adam for putting in resources that, Vive Connect has some great resources about how to navigate the insurance programs and insurance plans for long-acting PrEP. And that also there are, and Vive runs a copay assistance program.
Some questions in the chat about PrEP versus hormone therapy, and there's some discussion about how the insurance would not cover both, so the client chose hormone therapy, which makes a lot of sense. Gender affirming care can take precedence for someone versus PrEP. Yeah, I guess I'm wondering for folks on the line, have they seen something similar to this? Is this something someone would be open to talking with Greg about? Because ideally, they should be covering both. It's really not one or the other. They're not the same thing, and addressing completely different things.
Yeah, they're technically two different services. One is preventive care and one is gender affirming care. So I don't even know how they equate that as one or the other. That's really weird. I personally never experienced that in my work with trans patients. If anything, some of the issues that I have come across in working with trans patients is they're able to access both PrEP and gender affirming care, but also it's the matter of building a rapport and trust with the providers, and working with trans patients from a trauma-informed lens. But I haven't seen this come up in the trans patients that we used to work with at the PrEP clinic I used to work at. So does anyone have any insight on this? Has anyone else gone through an experience with this with a trans patient?
Yeah, it would be interesting to hear the rationale behind that. Regarding the question in the chat about the Vive copay card, it is for the medication. Another link that I put in the chat is NASDAQ has a whole long-acting injectable PrEP page that also includes an infographic on just the different dosing cycles and the initiation dose, the continuation dose. I know that later on in the PrEP navigation peer group, we're going to have some more discussions on long-acting injectable PrEP, because that is something that we could talk a lot about. But yeah, I encourage folks to check out the injectable PrEP page. We have a lot of different frequently asked questions that may come up for folks navigating PrEP services. What other questions do folks have, or other things that have come up for them that, you know, you have a whole bunch of peers on the call with you? This could be a good opportunity to just troubleshoot something, you know, more than what we've discussed. Yes, Adam.
I guess the biggest thing I would say is just thank you everyone for all the information, but also trying to reach out to your representatives. So I just went to a ViiV healthcare meeting that they provided dinner for us and gave us updates and resources on all the Aptitude and the ViiV Connect and kind of just the breakdown, and just reminding ourselves to reach out to those administrators technically and finding out if there are other ways that they're hearing in kind of the pipeline of what we can do better, because they're touching bases with all of us technically, and then kind of going back to one central space. So being able to try to figure out again from each other, like you said, Nicole, of just how we can get through this. And yeah.
Thank you. Yeah, you know, definitely utilizing those resources that are available. And seeing some more questions coming in the chat. So the Reed, I feel like that could be a whole other conversation on talking with third-party teleprep providers. NASTAD's having some conversations on resources to assist, you know, folks with just navigating that. That I feel like that could be a whole conversation on its own. And then as far as Michael shared, we've had a program where you can access the injectable using CVS pharmacies for uninsured folks. And then there was a question about challenges with Blue Cross Blue Shield insurance. Can anyone speak to those? Otherwise, I'm going to turn it over to Roderick to help close us out. I see. Oh, can you speak to modifier 33 and the importance of ensuring the coding is correct from the agency standpoint? Some patients may be receiving bills because the codes do not reflect preventative maintenance. And do you have a resource billing coding guide? You know, what a great question. And I'm so glad that you asked, Heather. So as Amy mentioned earlier, NASTAD's currently working on updating the 2016 billing and coding guide for HIV prevention services. We can share that link in the chat. Just know, like, we really are working on updating it. And some of the challenges of modifier 33 have been coming up where so modifier 33 is basically a modifier that's added to a code to flag to payers that the service is for preventative services and should not be covered with, should not be having a copay. And so some payers are not recognizing modifier 33. There's some challenges with sometimes putting the modifier onto a claim. So we are going to be talking a lot about modifier 33 and just different troubleshooting opportunities in our billing and coding revamp. We'll also be talking about some of the billing and coding challenges for long-acting injectable PrEP in this update, and you know, different ways to appeal a claim denial, a lot of different resources. So please stay tuned. And thank you so much, Roderick, for putting the link in the chat. It's getting updated. I'll pass it over to Roderick to close us out.
Okay, and actually, Nicole, did you want to do the Mentimeter now? You all.
Yes, so, as y'all know, this is our very first PrEP Navigator peer space, and we would really love to get your feedback. So I'm just going to walk through some questions for us, because ultimately this space is for y'all, and we want it to be the most beneficial. So in another browser or on your phone, if you can go to the menti.com, and we'll put the link in the chat as well, and use the code 4506-6168. You could also use the QR code too, because why not? I'm going to just wait for a couple more folks to join, and once we have more folks, I will advance us to the first question. To see, we've got 12 folks on so far, and we have about 44 folks on the line. So if we can just get a couple more individuals, your feedback's definitely appreciated. Okay. So what was the takeaway from today's session? Heard a lot of good information from Amy, had some good discussions, seeing that understanding cost sharing better, verification that the process is complex. Yeah, you all are not alone. There's a lot of challenges out here. Lab copays can and should be appealed. Appreciating the links to resources to help clients navigate billing with their insurance, access from different levels, enjoyed information on insurance issues and confidentiality, useful information on insurance and the payment landscape, having an open platform to discuss real PrEP navigation issues, definitely. And yeah, there's so much going on in the PrEP access landscape. I'm glad we could be here to provide a space together and talk through these things. Did this peer space meet your expectations? So we have yes, it exceeded my expectations. Yes, it met my expectations. No, it did not meet my expectations. And no, I came in not knowing what to expect. All right. How could this peer space be improved? Always down for growth. As we mentioned, this is our very first one, and want to make sure that this hour, y'all are so busy, and we want this hour to be as beneficial as possible. And if you don't have any ideas right now, you can put NA or something. And thanks, y'all. Thanks so much for coming. All right. Would you like to see breakout rooms used for smaller group discussions? So we know that sometimes it can be challenging to talk in a group of 40. So just wanted to get a gauge on what y'all think. And Julia said in the chat, if there were common questions from those in the group, we should have a session that covers the answers to those commonly asked questions. All right. Thank you. Cool. So yes, couple no's, no preference. Awesome. And then our last question, what would you like NASDAD to know about today's session or any additional feedback? And while folks fill that out, Roderick, do you want to share any closing announcements?
Yes. So Thank you, everyone, for your feedback. Thank you for joining us today. We hope that you were able to take something from the session. We do plan to meet every other month. So the next section will happen in July. We did have a date, but I accepted a presentation that's in Houston, so I won't be available for the date. So I have to meet with Cody and Amy, Cody and Nicole to come up with a new date. But once we have that confirmed date, we'll send out the link and registration for the next session to everyone that was a part of this session, okay? The slides and the recordings, the slides and recordings will also be emailed to you as well. And then also, I want to share my screen. Oh, was that a comment coming in? Okay, maybe not. And I'm just going to share my screen really quickly. I do want to also provide a resource that we have here at NASDAQ on the PrEP access newsletter. So I wanted to show you all how to sign up for that really quickly.
Well, two things with that. And
Can I see my screen?
Yes.
So you can use this QR code to get access to the PrEP access listserv and to sign up if you're not a part of that already. We post a lot of announcements in terms of what we're doing with the PrEP portfolio here in NASDAQ, and also any other resources or any other information that has come across our desk. So definitely sign up for it. Me and Nicole do this together. So yeah. And with that being said, thank y'all for joining us.
vision for that fraud is that we're not, we're paying that. We've already technically paid that out of it. So.
Well, I think Amy had to jump off, but big thank you to Amy for the presentation, and thank you so much, Roderick, for getting us together today, and hope you all have a good rest of your day.
Thanks, everyone. Take care.